here today at what is our second Fit for Work conference. This is a gathering of all key stakeholders involved with addressing the problem of musculoskeletal diseases in the workplace.
If you look at all the causes of ill health that has an impact in the workplace, high up there, if not the number one, is MSDs. Not only are they highest in terms of frequency, but in terms of duration of absence, typically is up to twice of a non-MSD.
It's simply not a health issue exclusively. We have IBEC, we have IC2 on board, we have other parties as well, which have very, very important input.
I think the critical part of the coalition is the fact that so many people have come together with different viewpoints and different understandings.
The Fit for Work initiative covers many major policy challenges facing Europe today. How to improve public health, how to maximise levels of employment, and how to improve Europe's competitiveness.
Under the EU 2020 strategies, EU governments have agreed a common target of achieving an employment rate of 75% by 2020.
So the position paper is a collective view of the coalition calling for early intervention, and what makes it interesting is it was presented in front of the Minister, and it was encouraging the signs that she is interested and willing to work with us in the next phase of the rollout.
I think that the work that's been done by the coalition and the whole concept of Fit for Work fits extremely well with the type of changes that the Department of Social Protection is undertaking at the moment.
Found the presentation fascinating. Also the level of savings that could be made by having such a regime in the private and the public sector on a health basis, but also on an economic basis. It seemed to make sense.
There are many elements, I think, to be considered when we're trying to reduce work disability for people with musculoskeletal disorders, but essentially that we examine the international evidence also to see what has been proven to be effective.
What we found across Europe is that both national and regional governments have been playing a much more of an active role in helping people with musculoskeletal conditions get early treatment, particularly if they're of working age, so they can stay in work or return to work.
For me, it's about putting together a model that recognises the importance of MSDs and putting in place an early intervention system.
A more flexible system that would let employers know what a person would be able to do when they come back at work, and how they could manage that in the workplace would be of value.
That is a huge problem for employers. How can they manage to keep people at work? How can they distinguish between those who are really working hard but just can't because of various reasons?
Obviously it's very important for all workers that an agreed approach to the management of absenteeism is in place. That leads to a healthier workforce. It also leads to more productive organisations.
What are the consequences for the enterprise, for the firm, for the school, for the hospital? If somebody with 20 years work experience has to leave the workforce because of an MSD, there's a loss of productivity, there's a loss of institutional and enterprise knowledge, etc.
We're looking with the Fit for Work Coalition to review the whole process of sickness certification, to see can we introduce a rehabilitative component, to look at the whole area of certification in general and see can we improve, I suppose, the interaction between primary care and the workplace in terms of encouraging rehabilitation to work.
I worked in a small organisation, so we would have had quite low numbers of staff, so there wouldn't have been access to occupational therapy within that organisation. So certainly if all organisations, big and small, have that access, that would have made a huge difference to me to maybe find ways of staying in the employment for longer.
Ultimately, it'll mean a lot more people with MSDs returning to work earlier, which will have a significant benefit on their health and their social inclusion and their financial situation as well.
Employers can do a great deal, but organisations such as Arthritis Ireland can do a great deal as well, and making people fit for work is worth supporting.